Hello, welcome to this poster presentation called Culturally Safe Indigenous Health Research and Practice, a webinar series co-created by community-based researchers and the Canadian Consortium on Neurodegeneration in Aging's Indigenous Cognitive Health Program. My name is Sebastian Lefebvre, and I am the Research and Development Coordinator at Mamwesing North Shore Community Health Services, and I am joined today by Michael Ann McLean, Research Projects Coordinator at Nojibwawanteg Health Center, and Cassandra Lowen, Research Coordinator for Dr. Jennifer Walker at McMaster University. I would first like to acknowledge the traditional lands and communities involved in our work. This poster presentation is being recorded in the city of Greater Sudbury on the traditional lands of the Atitmishing Anishinaabeg, and part of the city is found on the traditional lands of the Wahnapitae First Nation. I would like to acknowledge the First Nations communities on Manitoulin Island, which we worked with Wikwemgong Unceded Territory, Chiging First Nation, and Cheshagwaning First Nation, and also the communities on the North Shore, Atitmishing Anishinaabeg First Nation, Sagamok Anishinaabeg First Nation, Serpent River First Nation, Mississauga First Nation, Thessalon First Nation, Gun River First Nation, and Batchewana First Nation. Disclosure, we have no relationships with for-profit or not-for-profit organizations, and this research project was made possible through a grant from the Canadian Institutes for Health Research. So the Indigenous Cognitive Health Program, the ICHP, is an initiative of the Canadian Consortium on Neurodegeneration and Aging, the CCNA, developed a resource entitled The Pathway to Culturally Safe Indigenous Health Research Practices. So to illustrate steps along the pathway using real-world examples, the ICHP partnered with Indigenous community-based health researchers to co-create a webinar series. A postdoc project review using Zoom platform data suggests the series was favorably received. So this poster will describe the project and the results.
There is a demonstrated need to increase the capacity of university-based researchers to enter into meaningful, culturally safe research partnerships with Indigenous nations and organizations in order to ultimately advance Indigenous health equity. The Canadian Consortium on Neurodegeneration and Aging, the CCNA, is a national network of research committed to the advancement of dementia research. This large initiative includes the Indigenous Cognitive Health Program, is a cost-cutting program serving the entire network dedicated to advancing ethical and culturally safe Indigenous health research practices. To advance its objective, the ICHP created an online collection of resources entitled The Pathway to Culturally Safe Indigenous Health Research Practices. This pathway is organized into 4 steps, each building on the previous one, and I encourage you all to look at image 1, which is an illustration of the ICHP pathway. There's also a QR code on the poster to take you to the website. In the fall-winter of 2021, an initial webinar series was hosted covering all the topics of this pathway. And another series was scheduled to take place in 2023-2024, this time offering more advanced insights drawn from real-world Indigenous health research projects. And again, these resources are available online.
In 2016, Mamwesing North Shore Community Health Services and Nojibwawanteg Health Center, both are Indigenous governed primary health care organizations located on the North Shore of Lake Huron and Manitoulin Island, partnered with hospital and university-based researchers to launch 2 CIHR-funded research projects. These projects are called MindCare and WiseCare. MindCare meeting models of Indigenous dementia care, and WiseCare, holistic, integrated, safe, and effective care for Indigenous adults with multiple chronic conditions. And the name of the projects within the language for MindCare is Minan and Damwan, thinking good, feeling good, and Kod Nagon Wadon, we are all leaders, we will lead the way. Both projects are scheduled to conclude in March of 2024, and community-based researchers are focused on communicating what they have learned back to the community.
In terms of the objectives for this webinar series, ICHP sought to increase the capacity of CCNA-affiliated researchers to enter into culturally safe research partnerships with Indigenous communities by collaborating with Nojibwawanteg and Mamwesing to create a webinar series illustrating what culturally safe Indigenous health research looks like in practice. Indigenous. Community-based researchers at NHRC, meanwhile, sought to share knowledge gained through Mina and Dadwin and Kanigan, both with academic and local communities.
For this project, what we did is we developed a 3-part webinar series. So the topic of each of the webinar was sourced from a step in the pathway to culturally safe Indigenous health research practices, while the content was drawn from the experiences of the Minanindamwin and Kaniganwadon projects. So to illustrate what culturally safe looks like in practice, we conducted more than 10 video recorded interviews with project leaders, community members, and elders. And then these recordings were used to produce videos that were played during each of the webinars. Following the video, then we had a period of discussion and then questions. So this novel approach enabled interviewers and interviewees to share their experiences being involved in the Mind and Wise Care projects with Mina and Damwin and Kaniganwadon, offering webinar attendees a real-world perspective of the application of culturally safe research practices. We retained control over the interview footage as communities, and which we plan to use in the future for knowledge translation and dissemination activities. So a total of 3 60-minute webinars were held in October 2023, December 2023, and January 2024. The first of the webinar series explored the context of Indigenous health research and practice. The second highlighted the significance of practices of culturally safe partnerships. And the final one illustrated the practical application of Indigenous data sovereignty principles. All the webinars were recorded and made available on the CCNA website, which at the bottom of our posters, we have QR codes that can lead you to those if you're interested in viewing them. And through Zoom, we were able to track registration, attendance, and exit survey data. The exit survey consisted of 4 open-ended questions, and the webinars were promoted by the CCNA affiliated accounts on Twitter and via the CCNA e-newsletter.
In terms of results, we tracked registration and attendance numbers, which increased throughout the webinar series, as illustrated in Table 1. Additionally, we conducted an exit survey, the response rate of which was consistently quite low. However, for those who did complete it, a majority indicated that the webinar series was useful. Several specifically mentioned that the recorded interviews with community members were especially valuable. A majority also indicated that the webinar series had taught them something new, and a majority were able to identify how they would incorporate topics covered by the webinar into their work. So this together suggests that the webinar series was well received. However, there are some pretty significant limitations with the approach that we used. Future evaluations, post-event evaluations, could add richer insights by utilizing more robust methods, such as pre-post surveys or qualitative interviews. And in general, we'd also switch to using more close-ended questions instead of open-ended questions in order to achieve a higher response rate.
In conclusion, partnering with Indigenous community-based health researchers to co-create a webinar series that provided illustrative examples of culturally safe Indigenous health research practices resulted in a product that seems to have been well received. So constructive feedback suggests future ICHP initiatives to perhaps have an expanded format in order to cover additional content and provide more time for discussion.
Thank you for joining us today on our presentation for the poster Culturally Safe Indigenous Health Research and Practice, a webinar series co-created by community-based researchers and the Canadian Consortium on Neurodegeneration and Aging, the CCNA Indigenous Cognitive Health Program, ICHP. If you have any questions, don't hesitate to reach out to me by email. My email is sebastian.lefebvre@manoia.ca. So Sebastian, SEBASTIEN .LEFEBVRE @MMNINOEYAA.ca. Thank you very much.